Hi, it's Tom here from Running Physio. Today I want to talk to you about foam rolling and stretching and what effects it has on the ITB. And in this video, we're going to talk a little bit about some new research that's actually explored this. Now, to give you a bit of background, a lot of runners, when they get ITB issues, will instinctively reach for the foam roller. It's what our fellow runners will often recommend, therapists will often recommend, but there's a big question mark over what effects it actually has, whether it's going to help or whether it could actually aggravate it. So we're going to talk a little bit about this new research and make some recommendations for you to use in clinical practice. Now, Itb syndrome is a tricky one to treat, so we've put together a great free video series you can access directly through the link that I've shared there in the title. So do check that video series out. 3 great videos all about assessment and management of iliotibial band syndrome. So let's talk a little bit about the background behind foam rolling, stretching and the ITB. Now, there is some evidence that foam rolling may actually create some short-term increases in range of movement, but it does tend to be fairly short-term only. There's not a lot of evidence to show that foam rolling is going to create long-term improvements in flexibility. There is also some evidence with foam rolling that it may decrease pain, but interestingly enough, in some of the studies what they found is you can foam roller one leg and have a reduction in pain in both legs. So it might be actually that it's a central effect, it's affecting the central nervous system rather than some kind of myofascial release of the ITB. And then with stretching, again, there is some evidence that stretching can improve hip adduction range of movement, but again, these results are likely to be fairly short term, and we think that probably the length change is occurring in the TFL, the tensor fasciae lata muscle part of the ITB, rather than actually lengthening the ITB itself, which would make sense. If you think about the iliotibial band, it's this tough, strong structure. It's adhered to the femur along its length with various attachments there, and actually it needs to behave a bit like a spring, a bit like a tendon would do in managing load. So we wouldn't necessarily want to make it a lot longer anyway. So we've got a bit of evidence that foam rolling and stretching possibly can increase range of movement in the short term. They may have some effects on pain, but what about actually on the ITB itself? Well, some recent research from Pepper et al. In just published 2021 has actually explored this. And this is quite an interesting study. They used something called shear wave ultrasound elastography to try and assess the changes in tissue stiffness in the ITB. They also assessed changes in range of movement. And they took 30 healthy volunteers and they randomized them to one of 3 different groups. So either foam rolling, stretching, or a control group. And now if we look at their intervention, there'll be things you'll be familiar with. So the stretching looks a little bit like this, your kind of classic ITB stretch. In this case, the person's stretching their right leg. So the leg is extended and adducted, and that's coupled with some trunk side flexion. So they used these stretches, and actually they did a kind of hold release with this from what I can gather from the research. So working the abductors for I think it was about 7 seconds before maintaining a stretch for about 15 seconds. And then they compared this to foam rolling. And again, sort of a technique that you'd be familiar with, both these images coming from Fredrickson and Weir's research. So your kind of classic ITB foam rolling technique where you lie on your side and you pummel the ITB with the foam roller and usually sort of grimace and squeal out a bit in discomfort because it's not a particularly pleasant thing to do. Now, in this study, they did 5 times 1 minute with the foam roller as their intervention, which is similar to other studies. It doesn't need to be, you don't need to be lying on a foam roller for half an hour or so and really pummeling the ITB. So they then look to see, did this stretching or foam rolling, did this result in increase in range of movement? Did it actually change the stiffness in the ITB compared to the control group? Well, this is what the study actually found. They said that single bouts of foam rolling and stretching did not change the ITB stiffness and may have limited value in reducing ITB compression. So actually, in this study, it seems that rolling the ITB and stretching the ITB don't change its stiffness and don't significantly change range of movement either. There was only a 0.8 degree increase in hip adduction, and this increase was also found in the control group, so it was probably down to measurement error. So it seems then that it's unlikely sending our patients with ITB issues off and saying that they should be foam rolling the ITB, they should be stretching the ITB, is actually going to increase their range significantly or actually reduce the stiffness in the ITB itself. Now, what do we take from this? Well, does that mean that we abandon stretching, we abandon foam rolling altogether? Well, not necessarily, because what we don't know from this study, because it's on healthy volunteers, is whether these techniques change pain. And I think that remains a little bit of a question mark around them. They do have the capacity potentially to change pain. So it would be interesting to see some research in people with iliotibial band syndrome to see what effects does this have in pain, both in the short and the long term. And I would say on an individual basis, I wouldn't make foam rolling or stretching the priority with someone with iliotibial band syndrome, but it might be that you could use it to see if it alters their pain in the short term as an adjunctive treatment. So let's say typically a runner comes to you, they've got Itb syndrome that you've discovered from your assessment, and they say, well, I do some foam rolling and it actually helps me. Maybe you could try it within the session if they've got an objective marker. Maybe a single leg squat, for example, is causing them some pain, and you try some rolling and it reduces that pain, or you try some stretching and it reduces that pain. I think it's reasonable to use that as part of your intervention, providing there's no reaction afterwards, if it is giving them some short-term pain relief. But I'd be quite aware that this is often just going to be short term, and runners quite often use things like stretching and foam rolling as a bit of a sticky plaster to allow them to continue training at a level above what their body can cope with. So they train too much, they feel tight, they get pain, they pummel themselves with the foam roller or give themselves a good stretch and they feel better. So they can continue that training, which they're probably not really quite ready for. So if we're going to use it in a way that might reduce pain, but as an adjunct to the other treatments that we want in iliotibial band syndrome. So in particular, what we need to make sure is that the load management is right. Look at their training and see if it's excessive, if it's aggravating their symptoms. And with Itb syndrome, there's a number of different things that will do this. It's often longer runs, so pain will often kick in towards the end of longer runs where fatigue might be a factor. Downhill running can be a part of the puzzle, running on a camber and running on a fatigued state, maybe if they're doing lots of other types of exercises, cross-training, strength work, etc. So as a priority, get that load management in place, get them to modify their training to a level where they're not getting that really sharp, uncomfortable lateral knee pain that can stop them in their tracks. And then look at what their rehab needs are. And of course, we talk about this in more detail in the video series about what muscles you want to assess, what muscles you want to strengthen, how to assess running gait, etc. But we want to try and improve their capacity to manage running alongside trying to bring running down to a manageable level. So we might typically look at things like the glutes, the quads, etc., see where they might need to be stronger. Because if we just send people away rolling and stretching, it's not really going to get to the underlying issue here, that the ITB is often being overloaded, or that there may actually be areas of muscle weakness that we can work on to really help address that, or change aspects of their running gait to reduce the stress on the ITB itself. Okay, so some food for thought there, and just to summarize the findings really of this, we think that foam rolling and stretching, they're unlikely to make significant changes to ITB stiffness, and they're unlikely to make significant changes to range of movement, particularly in adduction. We also think that we don't necessarily want to make the ITB less stiff. It often feels stiff and tight to the runner because it's overloaded. That's a symptom of overuse. It's not a physical shortening of the ITB. So we don't really need to make it longer. We actually need that stiffness there to provide stability through the hip and the knee. So you're thinking of the foam roller or stretching to address stiffness, it's not going to do that, and that's not really what we want anyway. It may have a small role in addressing pain, but we've got to look at that on an individual basis and actually demonstrate that it's effective for that individual, and be aware that sometimes rolling and stretching can really aggravate symptoms, particularly if they roll over that distal ITB where it's very tender. So bear that in mind. It can make things worse. And when we want to get good results with the iliotibial band syndrome in runners, we've got to think a lot more around load management, education, targeted strength and conditioning. That's what's really going to get them there. The rolling and stretching, probably much smaller piece of the puzzle for a select group that actually benefit from it, but it's not really going to get them the long-term results that they want. Okay, thank you very much for listening. Do check out that video series. You can access video 1 directly through the link. It will give you loads more information about ITB syndrome to help you manage it in clinic. Okay, thanks again for listening. Bye for now.